Oak is one of the great healthcare investors. And I know you serve on the boards of Axial Healthcare, Cricket Health, Firefly, Maven, and Unite Us. All right, so Nancy.
Yes.
Been in health tech for a long time. And well, I don't mean that long. We both look great, so don't worry. But this past year or so has just been like irrational exuberance in a sense of so much going on in the digital health space. So, based on where your history in health tech, what's different about today, and how are you feeling about the environment?
Well, first of all, I will confess I've been doing this for 33 years, and my firm was nice enough to add all those years up, just in case I had forgotten how long I've been around. So, and you're only talking about the last year, but I have to go back and just tell you how excited I am that we have so many phenomenal companies that are cropping up and have been. Back when I started and entered into the world of, I guess, my first digital health, we call it now, even though digital health is a very broad term, but the first time that we were adding computers to healthcare in my first startup, which was in 1999, there were only a couple of investors in healthcare, digital healthcare at all. And there were very few entrepreneurs. And in fact, one of them was Annie Lamont and Andrew Adams, who I work with at Oak, but there were very few. So it is unbelievable to me to see the amount of interest that we have in healthcare overall, how many incredibly smart people we have who've come in from tech ranks, and how many companies are interested in this. And then just when I thought it couldn't get more exciting, the last year happened. And I think a couple of different things happened. Obviously, the pandemic happened with an unbelievable focus on healthcare in every regard, from development, vaccines, to logistics, to virtualization. So now I think that laser focus on how do we get care to people in an efficient and effective way has gotten everyone's attention. And we're in an unprecedented time of companies getting started, valuations being very high, and more than anything, I hope the creation of value through these companies.
Yeah, well, I would hope too about the creation of value. Now, last week, Oak had a big announcement. You raised a new fund for, I guess, 1.4 billion with a B. And so the title of today's talk is "Where's the Money Flowing?"
Yeah.
So, where are you set? Where are you putting your bets, or what areas are of most interest to you?
So we serve both the healthcare and fintech market. So I'll talk about the healthcare market, and it's going to be more of the same, which is, so we have always, from the beginning of the fund, which was 7 years ago, this May, I think, is our 7th anniversary when the fund began, when the company began, and the first fund was raised. We focused on undeniable problems in healthcare and about movement on cost and quality. So way back then, we did things like palliative care. We did a lot of virtualization of care in areas that are very complex, kidney care, opioid addiction, a lot of primary care, all about access. So we're going to continue around the path of finding these undeniable problems, continuing to focus on not only medical, but also mental health, social determinants of health, and other areas. And we also particularly are drawn to very complex populations. So we've done a lot in the Medicaid area. Really, whatever needs tech-enabled solutions to get to a problem that really has not been solved through traditional means. So we will continue to do the same. We get to continue to work with some of the best entrepreneurs ever, and work side by side in even larger companies to bring these products to market.
So in the Medicaid space, and over the past couple of years, we've seen a lot more investment there. And we're in New York. I should have mentioned that Nancy's in Boston, but we love her and we love Boston. In New York, we Unite Us is one of your companies, right? Yes. Yeah. So can you talk a little bit more about what's going on in the health equity space and companies like Unite Us? What else are we maybe going to see?
Yeah, so I think for anyone who hasn't noticed it, Medicaid's the largest payer. And so I think around the time, I'm not doing a history lesson here, but about the time that that Obama, the Obama administration was focused on expansion of healthcare and increasing access to healthcare, they expanded Medicaid. And people woke up, health plans woke up with millions of Medicaid members and realize something which is probably somewhat obvious now, that this is a different population. And by the way, it's not a population. There's many subpopulations within the Medicaid population, but the problems that you need to solve are different and more complex. And the greatest example of that is social determinants of health. I think everyone's familiar with the term, but this is really all the things that surround people to make sure that they can thrive. Housing, food, transportation, mental health, ability to get a job, clothing, all of these things. And so this has been any of our companies that are focused on Medicaid, for example, whether it's on the mental health side or it's primary care, they have to have a social determinant of health capability. And many of them are turning to Unite Us. And Unite Us is a company based in New York City with offices throughout the United States now. And they are connecting folks to the community-based service companies that can fulfill those needs. So they established what I always call is sort of the terminal end of the terminal end. So the ability to connect, to place an order for someone for housing and transportation, to get those orders filled, and to really be able to do some amazing amounts of data analysis as to the correlation between the ability to fill those orders and the ability to improve health status. So this has been remarkable. The other big, area that, even 10 years ago was not as accepted is mental health. So we have a company, New York City based, Quartet, which has been all about connecting patients with mental health services. And that is paid for by the payers, because it's undeniable and shown through the data that if you are able to treat someone's mental health, that they will do much better in their ability to manage their chronic conditions. So now I feel like after 20 years, we've got all of the things that affect your ability to affect change with folks as identified and being covered and being managed. And sadly, with the pandemic, there was just a laser focus on this. We saw the disparities, and we saw governors step in. So Unite Us is a product that's also bought by many states to put in place to be able to manage these issues. But we couldn't be prouder but to back the entrepreneurs there and the work they've been doing.
By day, I run the healthcare program at Columbia Business School. And so Dan and Taylor are both graduates of Columbia Business School. So we've met them a bunch, and they are doing great work. So we were going to have Faye here today, and virtual care is undeniably, I've called the breakout star of 2020 in so many different ways. And so Firefly is virtual primary care. You've been with them from the beginning. Mm-hmm. And so tell us a little bit more about that model. Like, what is virtual primary care in reality?
Thanks for asking. I just answer this question whether someone asks me or not every day. First of all, I'll start with the fact that it's primary care. So we have a trend in the country where people are not picking primary care doctors. They don't understand. If you sort of did a survey of maybe, I don't know whether the audience for this event would be the right audience, but if you do a survey, particularly of millennials, a lot of people don't understand the role of a primary care doctor and why they should have one. And so as you mentioned earlier, I grew up in the staff model HMO where the primary care doctors proactively managed your care. They got to know who Nancy was and exactly what her needs were. And they didn't wait for you to show up and to ask for care. They actually proactively reached out to you and talked about your health and what you needed to do to maintain your health and to improve your health. And then they controlled everything with the hope of getting to a cost quality equation. And they also had every bit of process associated with your care identified: health maintenance, managing kidney disease, managing diabetes. All of these things were defined, and the processes defined, if followed, would get you to a certain outcome. So people have lost that. They think that they don't really understand that they don't understand the difference between proactive virtual primary care and, let's say, a teledoc where you call and you've got or someone who's just taking care of a sore throat or taking care of an urgent need, where you call, you get that need taken care of, and you move on. Firefly was founded by two physicians here in Boston, Andy Ellerin and Jeff, and they're considered primary care reform people. And so that's another thing, people don't know what that is. And that's really the defining of what primary care should be, again, to get to cost and quality, and how it's evolved over time. So Firefly has created a virtual primary care capability. You sign up, you get a doctor, they proactively manage your care, and they are responsible for guiding that care and for arranging all the care that you need to have. So they keep as much of it virtual as possible, which is, again, we're doing a tremendous amount of virtual primary care and virtual specialty care at Oak, because that's the way people want to. Nobody, I don't think, on this call is thinking, I would like to hang up now and drive somewhere and be seen by a doctor and wait in a waiting room or wait on hold. People want to go to an efficient and effective model. So Firefly has had their clinical model defined for years. Now they're implementing it. And they have a term, which Faye would talk a lot about, which is the ability to deliver half-price healthcare that's twice as good. And what they mean by that is they're working with employers. So this is a product sold through employers. They're trying to get the cost basis down and then have it feel like a concierge service, which is what it is. So 7/24 access. So this is true managed care in the best sense of the word.
That's so, and how do they work with specialists? Do they?
Yeah, so if you run out of things to do tonight, you can read their press releases, and you'll find that they had that. In fact, Jeff Greenberg, who is one of the founders, he's responsible for network, and so they're going to the best of the best. They just announced a relationship with Dana Farber. They have a relationship with Jocelyn Diabetes. So they are handpicking the specialists that people will see, and they are in many cases providing virtual, their access to virtual specialists, so keeping it going, and also making sure that people, not only go to the right specialist, but go when they really need to go and not go when they don't need to go. And then for other things, there of course is a physical capability to go in at times you cannot avoid, but having someone see you. So they have the ability for patients to come in and to be seen, but it's really minimized to just the few interactions that are required to be done that way.
So we have a couple of minutes left, and just for those who join later, we are going to have Q&A with Nancy and the other panelists after at 6 o'clock. So if you want to join, we'll post the link. One thing I've noticed, there are a lot of digital health companies, right?
Yes.
The proliferation is pretty huge. It's massive, especially in New York. I tell people, like in 2009, it was like 9 companies, and now, it's hundreds and hundreds of companies. But they're all many of them are going after the same buyer, right? They're going after employers or insurers or a health system. So is there fatigue on the other side? I mean, when you have to look at all of these different solutions, some people call them point solutions, are you seeing fatigue on buyers? Do they want a broader offering, or what are you seeing?
Well, based on the question, I think you probably know the answer to this already, which is yes, there's fatigue. There is. So we spend a lot of time, as I'm sure other people do, talking to the end user, so employers and payers. And yes, so every time they pick a point solution and they have to deal with the vendor, there is a tremendous amount of work that goes into everything from making sure that that they are integrating with that vendor and their core systems, how they're going to be introducing these systems to their employees or to their members, trying to really understand and verify the difference. So yes, they're looking for platforms that can handle more than one disease state. But I'll tell you something. these digital startups are not all created equal. So let me just say that what they're really looking for, even more so, is efficacy. So is actual proven outcomes. And the outcomes most often are presented by many of the entrepreneurs as how many people are using my system. And so people are onto that. Like you can get a lot of people on a system, but that does not mean, let's say we put a lot of people on virtual physical therapy. Does that mean that we're actually getting to the outcome? We might be avoiding some cost, but are we getting to the outcome that we're looking for? So they're getting smarter and smarter, as they should, the buyers, and they're really wanting to look for not only some depth and breadth, but they want to make sure that they can see based on data analytics that the result is what it should be. Having said that, though this year has been there's been such advancements in the understanding of what we can virtualize. So net, it's been a very positive year for digital health, particularly around areas of mental health and chronic condition management, and probably more to come as we try to keep people out of harm's way and try to make these products more consumer friendly.
So what you should know is that Graham is an investor in Marg's company, right? So Graham's an investor, and I'm saying it wrong, right? It's not Lerer Hippeau. How do you say
Lerer
it?
Hippeau, but you're close.
Lerer Hippeau. All right, I'm close. So why don't each of you just Graham, why don't you give a little intro and then we'll go to Marg and get going.
Sure. So we're an early stage venture fund, seed, Series A. We actually just turned 10 last year. We're based in New York, and we're one of the most active lead investors here. And so New York City makes up about 2/3 of our investments. And we're a generalist fund, so we're roughly split between consumer and B2B businesses, big sort of swaths. We do a lot of e-com and online brands. We do a lot of marketplaces, a lot of software investing, and a lot of next-gen content models. I think many things that New York's been particularly good at over the last decade. And we made our first New York digital health investment in 2013 with Oscar. And I'd say things have really accelerated in our efforts and the resources behind what we're doing in digital health over the last 5 years. And so some of the more recent companies include K Health, which is here in New York, a business called OpenTrons, which is now doing the majority of COVID testing for the city of New York. And then of course, Medley, and Marg, and we'll talk a bunch about that in a minute. But I think needless to say, we really love the ecosystem here, and we think there's a really bright future for healthcare innovation in our backyard here.
Well, congratulations on Oscar, having gone public yesterday. And Graham's also in our report, so you can learn a little bit more about him there. So Marg, tell us about Medley.
Yes, hey everyone. I'm Marg, CEO of Medley. I'm a second generation pharmacy owner and have been in the pharmacy space for many years. I'm also a doctor by profession. I usually never mention that, and Bunny insisted I do. So there you go. My brother and I co-founded the company in 2017 to create a customer-centric pharmacy, right? So rather, I would say the most customer-centric pharmacy, and to simplify the process for everyone, right? So previously we have been running independent pharmacies in the New York metro area. We self-funded the company all the way from the start till we met Graham in 2018 and finally got our first round of funding in 2019 with Lerer, Hippeau, and Greycroft.
So you've had a big year. You got $100 million in Series B, I believe in July or August, and you opened a warehouse or factory in Bushwick near me in my neck of the woods. So why did you start Medley in the first place?
It's being second generation pharmacy owners, we were so close to the space, right? We grew up in the space, we understood the pain points, we saw the opportunities to improve the customer experience and really create value in all ways, right? So we thought to ourselves that how do we take our brick and mortar business and leverage technology, add distribution and add services to really elevate the experience for not just the patients, but all the different stakeholders, right? So we have more of an integrative approach where we work with the doctors, the patients, manufacturers, and insurance companies to really create all-round value. And that's what we saw was really missing is that really all-round pharmacy service, ultimately to benefit the customer. And not only that, it leads to better adherence and better outcomes, which ultimately is at the core of our mission.
So Graham, what did you see in Marg? What's the backstory? Why did you invest?
Yeah, the backstory.
Take your money.
Yeah, I mean, almost the better question would be for Marg and why he let me invest in Medley, as they had bootstrapped a really impressive business when we first met him in 2018. So the backstory, my colleague Caitlin actually found the company, and I think was first introduced, I want to say late summer, maybe early fall 2018. But we'd been looking at different opportunities, I think, across the value chain in pharmacy for years. It's a massive space. I think retail value somewhere in the 500 billion range. I think what was sort of struck us early around Medley and what they were doing, I think, was both sort of how they handled specialty and chronic and sort of a continuum of care that was a bit different. In that, specialty as a volume is much less than half, but I think as a dollar value is approaching half that entire market. And so just a growing market, and someone that really understood the ins and outs, and the category, I think, like much of healthcare, has been largely resistant to tech innovation, and there's just intermediaries that capture huge amounts of profit. I think $100 billion of gross profit sort of captured by different intermediaries, from going from manufacturer to where you actually get to the consumer. Mm-hmm. Marg, his brother Sahaj, and Chirag really struck us with, I think, a combination of deep domain expertise plus some modern lens in a really consumer first mindset, which resonated with a lot of how we think about creating online brands and, how we position and message and treat a consumer. And so, Marg mentioned this, but growing up in a pharmacy, I think there was a real appreciation for the various needs of all the different stakeholders, not just the patients or customers, and as well as like what were the sort of insights around how we could leverage technology to create a better business and a better pharmacy. And so I think that perspective was really powerful. And it was, I mentioned we met in sort of summer, fall 2018. We spent a bunch of time getting to the team. It was, spring of 2019, I believe, that we finally convinced Marg to take our money. So well over half a year of really getting to know them, but also seeing them execute. I think they laid out an aggressive plan when we first met them, and every month they continued to beat that plan. And so just seeing the team, getting to know them and seeing them execute, was a great way to get to know them, and then being fortunate to be able to invest.
So the past couple of years, we've seen a bunch of different startups and in the space, right? Whether it's only pharmacy or pharmacy combined with some virtual care, delivery, et cetera. I spoke to somebody today who was starting like a micro, one pill or one type of pill for one thing, right? So what's your value prop? How do you differ from others in the space?
So Medley has taken, what we've done is we've taken the traditional pharmacy experience and really modernized it with technology, right? It gives customers a great experience. And we are confident that none of our competitors do that. And while the average pharmacy NPS is 28, ours, triples that at 87. And the services that we offer are really something that resonate with all the different stakeholders, right? It leads to better outcomes, it leads to better adherence. We work with, it's more of an ecosystem play for us, right? It's working with all the different stakeholders, the providers, insurers, health systems, manufacturers, and to create value all around, right? It bridges the gap in care to improve health outcomes, which I feel that this whole aspect around integrative pharmacy approach is really new. Traditionally, we've seen that, each of these players, they operate in silos, and we are kind of integrating them. And pharmacy being the last touch point is very well positioned to do so. And that's what we've taken. And the customer base that we have is quite different as well, right? We cater to the Medicare dual eligible population as well with chronic conditions, and that's where the bulk of our patients are, who really need that sort of integrative approach, that hand holding all the way from receiving the prescription all the way to, that getting to the patient's door.
And, the past couple of years, we've seen a lot about PBMs so how do you source the drugs? How do you work with PBMs? Do you work with them?
So we source the drug from the wholesalers, right? So most of the products we get from the wholesalers, the big three, the Cardinal, McKesson, and ABCs, and then so many others that we work with. But along with that, what we do is we also build manufacturer partnerships where we would purchase, from the manufacturers and create value in other ways for them as well. But with the PBMs, we contract with most major PBMs, and that's mainly for more of managed care sort of contracts, right? We contract with national and state level managed Medicaid, partners and other insurances as well. I think PBMs are amenable to opening the networks to high performing pharmacies like Medley because, the high quality service at the same cost as a chain or any other traditional pharmacy makes it very attractive for PBMs, because ultimately the goal for healthcare and for PBMs is to provide a large network to the members and that too at the lowest cost possible. And we provide both of that because with the delivery combined with the same rates, it's a win-win for PBMs as well.
What's your feeling in general about the whole PBM infrastructure? And do you see that changing at any point?
With entire healthcare moving, I'm hoping PBMs change as well, right? Because PBMs have historically been, not that transparent, while them as administrators, and which I feel is their main role, right? To be the coordinator and to provide access and a big network to the members. And PBMs are becoming more transparent because they're facing a lot of regulatory pushback and bipartisan pushback in many ways. Independent pharmacies are also pressing against the PBMs in a large way. But new transparent PBMs are emerging as well, which is a great sign. And they're sort of, going to that point where they are fulfilling that role that they ought to, which is to be that administrator and provide that network more so than engaging in non-transparent practices.
Graham, did you have anything to add there?
No, I think that's exactly right. I mean, you talk about, I think the big three are 2/3 or 70% of the market.
Right.
They are now integrated within plans. They function and make money on both sides of the equation, and anything we can do to increase transparency, I think is interesting. We have not invested in a next gen PBM, but we know there's a number that are starting up and offering a slightly different or taking a slightly different approach.
One point I'll add, Bunny, to that is that, the incentives of the PBMs, they are the ones who could control the incentives in a real way with, most of healthcare moving towards value-based payment with, most PBMs also, if they could move to value-based, there could be more value that could be created for the members in a very large way.
So Graham, what other areas are you excited about for 2021 and beyond in the health space? And second, how much time of your time do you spend in health versus other sectors?
Oh, ask me on any given week. This last week, it's been almost basically 100% of my time. We're working on something new that hopefully we can announce in a couple months. But there's a ton of opportunity, and I think while COVID and the move to Zoom has certainly flattened geography, we remain really excited about New York and the ecosystem here. Just being the largest healthcare market in the U.S. and having a really unique combination of talent, infrastructure, and capital. In terms of categories, I think tend to be just sort of a big proponent of looking for problem areas. And in healthcare, there are plenty. I think Nancy made some great points about social determinants and sort of where we are and some inequalities in the system. And I generally think there's a huge problem as well as opportunity around helping to either save money or reduce care inequality. And I think what we've seen over the last year, COVID has really laid bare inequalities in our health system, as well as the lack of safety net for so many Americans. And so we got to figure out ways to better finance, to be able to bring more cost-effective care to patients to solve access, and do so in a way that's, independent of socioeconomic standing and geography. And so I think there's a lot of opportunity for innovation here, and whether that's advocacy on behalf of patients or more easily bringing the right care to patients and doing so at lower prices. In terms of our portfolio, I think K Health is a great example of this sort of last type of company. The company uses AI to make sense of symptoms and help patients to better understand next steps. And so telehealth is immensely important, and it fundamentally changed over the last year, even though it's been around for, close to 2 decades. But it sort of alone, I don't think is going to fix healthcare. And so this idea of, what can bring us closer to this promise of universal access to quality care. And I think it's the ability, anyone with a mobile device to access sort of best-in-class resources that are personalized to individuals and individual symptoms. And so I think things that can sort of fundamentally change cost and access are things that are really compelling. And there's just a ton of areas, whether it's by patient population, by condition, where I think we'll see some really interesting things. Broad strokes, there's a lot of opening up of data. And so I think we'll continue to see more and more data liquidity. Open APIs will, I think, will sort of unlock data sets that will hopefully allow breakthroughs in things like disease detection, diagnosis, better patient risk assessment, improved clinical productivity, so productivity on the actual operations side. And then at the same time, figuring out a more automated way to do compliance with all this data. And so there's this like delicate balance of like, how do we use the data in the smartest way? And then also how do we remain within HIPAA compliance and security concerns? And so I think companies that can help to better navigate that are going to be really interesting over the next 12 months, but also sort of in the long term here.
So basically, folks listening in who have ideas can submit and send them to you.
Whatever way, yeah.
All right. So how often do you two connect? Like, what's the relationship? How involved do you get in Medley, and how much do you get involved in looking at new companies?
So I can start. I mean, I'd say we probably text the most and email as well, but it's constant. At the same time, we're early stage sort of founder aligned investors. We're not looking to run a company or meddle with the business. We're looking for like, where can we leverage our resources to provide any sort of unfair or helpful advantage? Medley's grown tremendously since we first came in, and now has a whole array of other great investors around the table supporting the business. And so I think we look for areas, whether it's around strategy, recruiting, branding, PR, things that we can help with, kind of all the time. And we also just sort of look to be a general sounding board for companies. And then Marg, I'm constantly running what are probably mostly bad ideas past Marg. And I love getting his perspective and experience and hearing how he thinks about things. So I think we're constantly trading ideas there on the new investment side.
What about from your end, Marg?
I love working with Lerer, Hippeau, and I would definitely say that, from our perspective, right, being a family business, and then for the first time getting into, raising outside funds, it was very interesting to see that dynamic, because to move from that family business mindset to getting outside investment is a real transition, and they made it really comfortable, right? So I can text with Graham anytime I like. Caitlin is always there. And they almost feel part of the team, right? They're part of the Medley team. So it's not, you don't feel that you're actually talking to a board member or somebody who's going to sitting on the other side. They're on your side, strategizing with you, thinking through about how to grow the business and just lending their experience, right? They see companies all day long. They can foresee any mistakes that you're making as well and provide good guidance. So, that has definitely been very, very helpful.
So, Harry, you were at Oscar in the early days, right?
It was, yeah. We had an
Congratulations, Mazel Tov.
It was very exciting. Mario, who's the CEO there, is an incredibly special person. So seeing him up there ringing the bell is definitely a moment we all will remember.
Yeah, you mean Mario?
Yeah.
Yeah, he's spoken to our group a bunch of times. So yes, we agree. Well, congratulations. And Brad.
Yeah.
You are all about New York City, right? Why don't you tell the audience a little bit more about Primary? And I know last week you announced a new fund for both seed as well as later stage. There's some money there too. So take it away.
Yeah, so I'm a co-founder and general partner at Primary Venture Partners, and my partner Ben Sun and I started the firm 6 years ago. We just announced our third fund last week, which is a $150 million fund dedicated entirely to leading, co-leading seed stage investments and pre-seed. It will go as early as you want. Harry's actually an example of that. But entirely in the New York ecosystem. So we're big believers that this is the, fastest growing, most important, biggest opportunity tech ecosystem in the country. And we made a bet when we started the firm that the rise that we've all now witnessed was going to happen. So it turned out to be a good bet. And we, like Lerer Hippeau with Graham, relative generalists, very founder driven, but I end up spending about 35–40% of my time in healthcare, and have over the life of the firm, and actually feels like that's getting more and more all the time because the ecosystem keeps serving up more and more healthcare, which is exciting.
So I said in my emails to you when Harry met Brad. So how did this relationship come about, and why did you invest in Alma? Well, first of all, actually, tell us what Alma is, Harry.
So first, thank you for doing this. Thank you for helping be, as Brad and everybody on the call is, such an integral part of making this such an amazing place to start a business. I think Brad's right. No place better than New York to start a company, particularly a healthcare one. So thank you. Alma, we are a membership-based network for independent mental health professionals. So our mission is to simplify access to high-quality, affordable mental health care. And we do that by empowering incredible clinicians with the tools and services they need to help take care of all the people out there who need access to care.
What I find so interesting about Alma and mental health overall, I mean, I think over the past certainly over the past year or two, we've seen so many different startups and new models emerging in New York and obviously, everywhere, but quite a few in New York. Many of them are really based on the patient and the patient experience and getting patients access. And what struck me about Alma is you're really focused on the provider, right? And helping them be able to help their patients. So how did you come to that? How did you come to start that? You're not a therapist. I mean, you are a doctor, but you're not a therapist.
Well, it's a great question. I think, we start with mission. For us, it's all about how do you simplify access to high quality, affordable mental health care for everyone out there who needs it. But the how, to your point, is a little different. I, as a clinician, have a deep faith in the incredible clinicians out there who are doing the hard work at the front lines, actually taking care of folks. And believe very strongly that when clinicians have the tools and resources they need to deliver great care, the system gets better for everyone. And when we looked at the behavioral health market, what was so fascinating to me about it was that, unlike when I graduated medical school and went out, to do post training and ultimately find a job, where most physicians end up in employed models working for large health systems, behavioral health has stayed very fragmented. Most clinicians are solo practitioners, single business owners trying to make it work. They're not trained to do it. They are not really all that interested in doing it, but they're being forced to really run businesses, and that's really not something that they're best suited to do. And so what we thought was, look, if we can create a model that is first and foremost about solving the challenge of these incredible human beings who are the real heroes in this story, doing the work at the front lines, we can create a really differentiated product for all the other stakeholders in the ecosystem that we work with, whether it's patients on one end, insurance companies on the other, or the employers that we work with as well.
Where are you in the, I know you just raised some money in 28 million or something last month. So where are you in your life cycle?
Well, it's interesting. I think as a startup, you're always in this, this interesting tension between feeling like the things are taking off and you're moving as quickly as you can, and then just holding on for dear life and trying to make sure that you're constantly living up to your own commitment of excellence and really producing a great product that serves the needs of the people that you're lucky enough to serve. We're very lucky right now to have had an incredible year behind us, as we've seen mental health really explode in terms of need, and really our value prop in particular, hit a really, I think, resonant chord with providers who have struggled during what's been a challenging year to figure out how to navigate, how to do telemedicine, how to take insurance, manage insurance relationships, all that kind of work. And so now we're really focused on growth. We're really focused on taking the platform we've built and starting in New York now as a regional presence, making that available to providers everywhere and anywhere that we can provide value, and then also making sure we're constantly pushing the goalposts forward in terms of quality and outcomes, and making sure that the experience is getting better for folks out there who need care.
So,
Bunny, tagging onto that, one reality of healthcare and why something like mental health as a market opportunity is so exciting is it's so huge. Harry's come a long way and built a business that's quite valuable now, and we're not even operating in our third state yet. We're just about to. And even, take Oscar as an example. How many states is Oscar operating in when they went public, Harry?
I don't know. It's a good question. Not all 50 yet.
Yeah. And so the opportunities are just massive and important.
where else are you? I mean, you have so many New York healthcare investments, whether it's virtual or mental health or back office. Where else are you looking for 2021 and with this new fund?
Again, as I said before, we're very founder driven. So we, at some level, we are eating what the market is serving to us, and the best founders are coming up with whatever excites them. But a couple of things. Obviously, telemedicine and what's happened with COVID has just cracked over a set of things that I think go way, way, way beyond just telemedicine. I think physicians have changed physicians and payers have changed their understanding of the way this entire experience should work. And I think, it took COVID to crack the door open on telemedicine. But my hope is that experience starts to crack the door open on a lot of different ways where the patient experience has just been so horrifically bad historically. And so I think there's an opportunity for, all of the kind of front room of care to be pretty radically transformed. We've been, just met somebody in the last few weeks who's like completely reimagining the labs experience. And in a way that I think if we had looked at that 13 months ago, we would have said this is going to be a really hard thing to pull off. And today, I think everybody's minds are just a little more open and a little more creative, and starting to realize how much opportunity there is to reimagine the whole experience.
Do you get any pushback from therapists, Harry? People who don't want to accept insurance and like the old way? Or
it's an interesting question. the thing about therapists and mental health professionals is that you're talking about some of the most incredible human beings you can imagine that are like walking on the face of this earth. I mean, I say this to our team often. To love your customer is a gift, and I just think we get to work with such incredible, exceptionally empathetic, kind, compassionate people. Their appetite for technology, their willingness or ability to change, and as time has passed, is something that is always a challenge. I mean, every profession taking on adapting new technologies, new ways of doing things is always difficult. But what we found is that when you speak to clinicians as a clinician and from the perspective of the clinician's best interests, and you're able to show how the platform and the technology and the way we work with you can really make a difference, the conversations are always in the right direction because their hearts are always in the right place of trying to improve access and improve affordability. So insurance is a great example. Traditionally, mental health professionals have avoided insurance like the plague. They haven't participated in insurance plans. The challenges have been a few-fold. It's been around reimbursement rates. It's been about administrative challenges. These are, as I mentioned earlier, not just small businesses. They're literally one-person businesses where every hour spent not seeing a client is 1 hour of revenue lost. And we come to them and say, look, we are for clinicians. We are doing this to try to help you as our core customer. We're going to bring smart, easy to use technology to bear to make the administrative hassle go away. We're going to work with insurance companies for you on your behalf. We're going to be your representative to make sure that we are negotiating contracts that make sense for you, that are designed to be administratively easy to work through. And your customer, your client, the person who you're trying to help, who may be struggling with worries about work or a job they might be losing, now is going to be able to use their insurance and get care for an average cost of $18 a session, right? Which is what it cost last year at Alma to get care, as opposed to $200 to $500, for cash pay. And for a clinician, the light bulb and the eyes widen, because now all of a sudden you're removing maybe the single biggest barrier after, or somewhere next to stigma, affordability. You're making it now possible for people to get the care they need using their insurance. And that's transformative. So there is sometimes resistance, but I think when you're able to changing modalities, but when you're able to, I think, package a product that's really designed for your customer, and create such benefit for both them and the people they serve, it can have a really transformative impact.
And Bunny, here's a reality that I spend a lot of time thinking about in all of the different industries that I invest in. If you're 47, 48 years old now, you probably did web research when you were in college. I'm 48. I used a browser and did web research for the first time my senior year. It's 48-year-olds are increasingly running big organizations, be it payers, be it big provider networks, whatever. And pretty soon, we're kind of, the Luddites are retiring. The people who would have resisted something like Harry's approach to mental health, 10 years ago are retiring. My therapist, who's probably 68 or 70, Harry doesn't have to worry about her. She's never going to get all the way there. But there are just things that we can do today in changing the system. And these industries like healthcare that are the last holdouts for a lot of, bringing 21st century technology into them, they're not going to hold out anymore when all of the people running them are at some level digital natives. So
you have said several times you are founder first, right? How do you assess entrepreneurs, especially first-time entrepreneurs? What are your criteria?
So it's a whole package, but there's three things that we think about a lot. One is founder market fit. And in Harry's case, Harry had one, he's a provider, not in mental health, but he has an understanding of the experience of being a provider. Two, more importantly, he had been at Oscar where he had built out their clinic experience and thought about fundamentally reimagining a consumer experience and a provider experience in a different environment. And so that said to us a ton. So there's founder market fit, there's grit, and it's, you know, it's easy to find people who are super, super smart and super, super talented. It's hard to find people who are super smart, super talented, and have that grit element that is just what it takes to tough it out through, you know, for Harry, who had a physical space driven model largely 13 months ago that was just starting to think about moving into a virtual mental health experience. And then all of a sudden, all of his physical space is closed down and revenue goes to near zero for a while. And it took Harry about 7 minutes to, like, boom, accelerate all the stuff we were going to do at some point down the road, like jam it forward into Q2 of last year. And by Q3, we were bigger than we had been in Q1 by a lot, and growing faster than we'd ever grown before. So that's the kind of grit and practicality. And then third is, and a lot of entrepreneurs don't want to hear this, but the reality is you have to be an exceptional salesperson, period. And I talk about the 3 unnatural sales that all founders have to make. You have to sell, especially B2B founders, you have to sell capital providers on parting with money that they know they're probably going to lose. But you have to convince me or Graham or Nancy that, like, you're one of the ones, you know, we're only going to do a few deals a year. You need to be one of the ones. Number 2, you have to sell employees on quitting the day job that they have that's probably very secure and they're being successful and they're well compensated. And if they, you know, called their mother and told them they were leaving to join this fragile little thing that nobody's ever heard of that has like 4 people and just raised some seed funding, like, they shouldn't take the job because they're taking it on the promise of the equity that's probably not going to work out. And so it takes salesmanship to get people to do that. And then you have to sell your customers, which in Harry's case is selling these providers on making a bet on shifting the way they do business. And everybody, if you looked at it, you know, practically and conservatively, all 3 of those constituents would say no to you. And if you're not a heck of a great salesperson as a founder, you're going to fail on all 3.
Those are great. Really, yeah, I hadn't thought of all the sales you have to make in order to, but that makes a lot of sense. Harry, there's one question and then we're going to go to the Q&A, but from the audience. Opening up mental health care to more people is amazing, but how do you make it scale as well? Because there will likely be an unequal provider-patient ratio.
It's a great question. The question of how does the market regulate and how do you think about supply and demand and the imbalance, I think, is very interesting. One comment just out of the gate I'd make is I think telemedicine and virtual care are playing a very interesting role in terms of balancing the supply and demand of a market. You know, you're no longer constrained by the therapists who might live within a 20-block radius of your house or place of work. You have the opportunity, and we're seeing that in particular in issues of disparate access to providers who are hyper-specialized or who have particular areas of focus. So use the example of providers in the Black community who are looking for a provider from the Black community. Now, all of a sudden, you're not constrained by who's just in your city or in your metro area. You can start to really expand out. You see this in the trans community and other areas where that's had a hugely important impact. The other, I think key element here is improving the efficiency of practices and driving towards outcomes and value. So, what we see a lot of times is it's not so much that there is inadequate supply to meet demand, but that the supply isn't able to access the demand because of all these inefficiencies in the system. You can't find the right provider. Once you do, you stay in care for too long, or you don't stay in care for long enough, or you're not using digital tools to enable the care experience so that you can do asynchronously what otherwise would need to be done in the room. So it's, there are over 1 million mental health professionals in the United States today. If you look at our core clients, almost every single provider at Alma is looking to grow their practice. So it's not so much even an issue that they're not there, it's that the two aren't finding each other. And I think that's where virtual care, smarter discovery algorithms, the use of insurance, all of that can make the market much more efficient. And also equitable, which I think is a really huge emphasis of companies like ours, and an incredibly important part of what the story needs to look like going forward for the mental health industry.
All right.
Geography is a terrible driver of friction in markets. And what we're seeing with telemedicine and so many other sort of marketplace driven models like Harry's got is how that technology can level the playing field and make it much, much easier for supply and demand to meet. I agree 100%.
And people need the technology. That's a whole other issue, right? For some folks who don't have it. But all right, so we are at the end of this. Thank you both so much. This was fun.